Welcome everyone to the East of England Mental Health in Sport and Physical Activity Conference. I'm Tom Horry from the Heart Sport and Physical Activity Partnership. I'm a health officer there and also lead on our mental health work. And today's conference is brought to you by the East of England Mind, Sport and Physical Activity Network, which is a collaboration between the active partnerships in the East of England. But there's a slot on the agenda where we're going to talk about the regional networks and the work we've been doing a little bit later. Before I pass over to James and Elsa from Mind, I'm just going to do a brief bit of housekeeping. So the agenda has been circulated, but just to refresh everyone's memory. So we'll be starting off at 9:30 with James and Elsa from Mind talking about Mind's Toolkit. And then at 10:30, we'll be going into some case studies from around the region, reflecting on how different organisations have applied elements of the toolkit to make their activities more inclusive to those with mental health conditions. And then finally, at the end of the day, we'll be joined by Rethink Mental Illness, looking at it from a more mental illness perspective, and also how they've incorporated co-production before finally reflecting on the work of the regional networks and the legacy of the programme going forward. Just the final bit of housekeeping then, in terms of making your experience most rewarding for you, we'd encourage everyone to make sure that you select speaker view for the best viewing experience. That way you'll see who's giving the presentation and be able to monitor it that way. All participants will remain muted due to it being in the webinar function, but we'd very much encourage everyone to use the chat box, kind of say where you're from, start networking, and encourage good networking amongst everyone there. There is also the Q&A function. We're going to make sure that we have time for questions at the end of each separate webinar. So if you could use the Q&A for any questions, but at the same time, we'll also be monitoring the chat. So if any questions go in there, we'll try and make sure that these get picked up. This webinar is being recorded, so it'll be distributed at the end. So if you can't make the whole event, or then it will be circulated to you afterwards. But without further ado, I'll pass over to James and Elsa to get us kicked off properly on the conference.
Thank you, Tom, and thank you so much for having us. It's a real pleasure to be able to present at this conference. I think it's my first time, and yeah, really excited by the agenda and the opportunity to share a bit more about our toolkits, which are 10 amazing guides that are being co-produced with various different organisations. I'm just going to bring up my slides, and I'm hoping everyone's able to see those. Give me a nod if not. Just before we kind of move into our section of today's webinar conference, just wanted to provide a bit of a brief overview of who we are. So I'm James, I'm the Physical Activity Young People's Lead at Mind. I've been with the team about 4.5 years now and worked on various different partnerships, from our partnership with the English Football League to our partnership with ASICS. And a lot more recently, my work's been focused on our engagement with young people, so individuals aged around 11 to 25. In 2021-22, I had the pleasure of working with a young people steering group who shaped and influenced some of our work. And Elsa, who's one of those young people that supported that project, has kindly joined us this morning. So Elsa, do you want to introduce yourself and just share a bit about what you've been up to since that before we move on with the webinar?
Yeah, hi everyone. Really nice to be here. I'm Elsa, I'm 22, and as James said, I'm a part of Mind's Youth Voice Network, which has allowed me to work and get involved with lots of different projects across the charity, from like working with the policy team to physical activities and all kinds, which has been really fun for the last few years. And my current main roles are as a young advisor for the Diana Award charity, which is specifically about improving youth voice and participation practices across their charity, and also managing the youth board for a disability empowerment charity called Flamingo Chicks, which is super fun and inspiring. So yeah, that's a bit about me.
Brilliant, thanks Elsa. And yeah, it's really great to be able to have you on the webinar today as we deep dive into our various different toolkits. Before I move on though, just worth saying that our session, we're really keen to keep it as interactive as possible. It's fantastic already to see the range of different individuals that have joined the webinar conference this morning. So please do keep introducing yourselves, as Tom said, and throughout the session we'll have opportunities to ask questions and share expertise from across the sector in the chat. So we really encourage you to engage. During our kind of 1 hour now, we're going to cover a range of resources that Mind's physical activity team have co-produced, and these are all available throughout our physical activity web pages. We're going to bring our toolkits to life and really share with you how you can co-design sessions with people with lived experience of mental health problems, and also explore how we can engage those individuals in your specific work. We're going to draw on a few different case studies, and I know there's some great sections in the conference coming later, but we'll discuss a bit about our work with young people, given that we're so lucky to have Elsa on this call. And we really would encourage you to post any questions in the chat if you want to pick them up at the end. So just before we move forward, by attending this webinar, hoping that you'll have improved knowledge of co-designing and delivering physical activity programs for people with mental health problems. We hope you'll go away with a better understanding of the barriers that people face with mental health, and that people face when they have issues accessing physical activity. And we hope that through this webinar today, you'll have a clearer understanding of Mind's resources and our information to be able to support you in your roles. Just before we move on, it's worth saying that obviously we will be discussing topics around mental health today. And if you find any of the content difficult, please obviously take some time away from the session. And if you need any support, you can reach out to Mind's info line, which is accessible on 0300 123 3393. Or you can obviously contact the Samaritans on 116 123 if you need any immediate support. Carla from our physical activity team is on hand in the chat as well and has kindly posted those numbers. So do access to the support if you need it. But we're hoping today's session should be a great introduction to some of our toolkit guides. So without further ado, Elsa, do you want to touch on kind of that first key aspect, which is obviously lived experience engagement, and run through what that means for us at Mind?
Yes. So really importantly, Mind, of course, works with experts by experience or people with lived experience to shape their work. And at Mind, we define lived experience engagement as the development and promotion of opportunities in order that a diverse range of people with lived experience of a mental health problem influence and participate in our work. So we really acknowledge that lived experience engagement can take so many different forms, which we'll explore in today's webinar. For example, as I mentioned earlier, I got involved with Mind through their Youth Voice Network, which is a community of 3,000 young people aged 11 to 25 who sign up for different lived experience opportunities. But of course, Mind also work with people of all ages who are experts by experience to ensure that we're representing a really diverse range of perspectives and represent people from a range of different communities. So yeah, a really important part of Mind's work that is really feeds in across all departments and teams at the charity.
Brilliant. Well, the first resource that we wanted to bring to life, I think, this morning is our lived experience ladder. And this is included in our Toolkit Guide 3, which we'll share a link to in a minute. Our lived experience ladder is a great place to start out and a really helpful tool to help you within your organisations and roles to identify what support you may need with opportunities and how you can gradually increase that level of lived experience involvement. We'll touch on the benefits to involving people with a lived experience of mental health problems in a bit. But I think this graphic is a really good way to show the different levels of lived experience involvement, and alongside some examples from the physical activity sector or the work that you may engage in. And we really hope that this tool helps you to identify what support you then need when involving people with lived experience in your work. It's really important to note, though, that different projects and programs will present opportunities to work with people in different ways on this lived experience ladder. And the most important thing that we'd encourage you to do is to start somewhere. So, for example, with our young people's work, when we launched our strategy in 2021, we worked with a research agency who used questionnaires and surveys to create audience insights. And there's some fantastic examples on our physical activity pages. On the back of that, we sought out the opportunity to work with a steering group of young people to co-create resources. So at that stage, we were moving up in terms of the levels of lived experience engagement as we were trying to work together and then do things together. And that project that Elsa was involved in, we'll touch on a bit later in the webinar. Since that, we've actually recruited a youth consultant who co-facilitates a new group, which is our Young People's Advisory Group. And they have equal responsibility to make decisions. To actually recruit that youth consultant, we worked with a young person to draft the opportunity, and we interviewed the young people alongside others. And that involvement in deciding together was really important. Our youth consultant, who's now helping to lead sessions from our Young People's Advisory Group, Risha, has fantastic lived experience. And I think we're really aspiring to continue working at those higher levels of lived experience with that specific piece of work. But as we mentioned, there's all different opportunities, and we're going to touch on a few in a second. But we'd really encourage you to reflect on this toolkit and then the specific lived experience ladder after this call, and think about some of those examples on the right-hand side of your screens. So what ways can you potentially start to involve people and then move up so we're looking to decide things together and lead projects with people that may have experienced a mental health problem? So Elsa, I'm going to pass back to you then to talk us through a few more of these different types of involvement.
Awesome. Yeah, so of course there are lots of different ways you can involve people with lived experience in your work, and the method you choose can depend on time, the level of involvement that you're looking for, the support you have available, and your budget. So yeah, the methods you choose might depend on those things. But if you're looking to improve engagement in a current program, you may want to ask people through things like discussions, questionnaires, or focus groups. So maybe some like shorter term ways of engaging them. And we'd really say to try and offer several methods for collecting feedback, particularly because by offering a range of ways to engage with your work, you're really encouraging people with different needs and ways of working with an equal opportunity to contribute to the work you're producing. So this will really make your program richer, but also be an important way to empower them in creating, through creating accessible engagement with what you're doing. So just as an example of that, my work with Flamingo Chicks, the charity I mentioned at the start of this, really involves working directly with young people with a range of disabilities and learning differences, which means if some people can't sit on a Zoom session because it's a really overwhelming space for them, we need to think about how we provide an alternative way for them to feedback, whether that's by email or they want to do a voice note or their own video, whatever works for them. And you can put that into the context of the work that you're doing, but it's really about finding ways that work for everybody to feel involved and an equal part of having their voice heard. So something to think about for you guys. And then you may also want to follow up with how you've implemented their feedback. So kind of, you said we did approach. I personally think this is so important. And it's so important to acknowledge the difference that sharing their experiences has made. You know, sharing your lived experience is a really difficult thing to do. And we do it because we want to help create change and make a difference and turn something negative into something positive. And so, yeah, really don't underestimate the power of closing that feedback loop and sharing the impact of their work, because it will mean a lot to them and will show that, you know, you're really not, we're not taking time for granted, and we're not taking the time they've spent to share their experiences and sometimes talk about really difficult topics for granted. So really, really important to kind of close that feedback loop and come back to them when you can. And then for longer term engagement, we'd suggest longer term engagement for maybe new programs that you're setting up. So you might be setting up a steering group or an advisory group where they're really involved in the decision making of the program, or being a part of like how it's delivered. So just really thinking about how you're recruiting those people. Should you be recruiting more than one person with lived experience so that you can have that really diverse range of perspectives, and people from different communities can influence your work. And we'd always say as well that it's so valuable to recruit and engage people with lived experience from outside of your organization who have no previous connection with your project or program, because that again helps bring in new perspectives and some fresh eyes, which we always need sometimes. So yeah, there's some different ways that you can involve people, but I'm sure you can also think of lots of other creative ways of really diversifying your types of involvement.
Thanks, Elsa. And yeah, really valuable suggestions there about how to do lived experience involvement. And there's loads more in our toolkit, which we'll share a link to in a second. But we know that there's many individuals on this conference this morning, and you're all experts in your own work. So we wanted to engage with the chat now and just ask a very simple question to start really promoting the importance of working with people with lived experience of mental health problems. So the question I was going to pose to you is, what are the benefits of involving people with lived experience? We'd love if you just took a minute to reflect on that personally, and if you feel comfortable, just to share a reflection or two in the chat about what some of those benefits are. It may be for your organisation, or it may even be for the individuals with lived experience. So I'm going to pause for a second, and would really encourage you to share that in the chat, as it's very much a two-way process learning today from this Toolkit webinar. So I'm going to pause for a sec as we ask people to respond to that question. Thanks, Liam. Yeah, a really good suggestion there around not assuming. I think that's really valuable. Paula, yeah, a great point about understanding barriers. We're going to touch on that in a second around those barriers. Oh my word, the responses are flying through the chat. But we've got themes such as empowerment, also showing empathy. Yeah, very much not assuming, as Emma says there, about the delivery being what's needed rather than us deciding what's wanted. Yeah, really, there's some brilliant points coming through in the chat, but again, picking out just a couple that I can see on my screen, that buy-in aspect as well, that validation for your programs that's connecting you with local organisations, especially within the mental health sector. Jackie, exactly, and the ability to grow in confidence as an individual. Well, please do keep those suggestions coming in the chat. It's great to share our own individual perspectives, and it's worth saying there's not a right or wrong answer with this, but I think it's really important that we do reflect on the benefits and really promote them as well across our organisation. It's not easy doing lived experience engagement. Sometimes we're actually choosing to take stock and invest more time in this. So it's really important we're aware of those benefits. So we're just going to run through a few examples, which I think many have been picked up in the chat already. So in terms of organisational benefits, and I think there's some really good examples that have been shared, we know that it's really important to understand the audience needs. So picking out on what people have said there about not assuming, but really taking time to understand what it looks like for those individuals. As many of you have shared, we develop a better understanding of mental health and various different services around that. I think our services, our programs and our delivery then meets the needs of a wide range of people, rather than perhaps supporting those or being targeted at those that we would typically engage or have worked with previously. There's also a really key point about gaining credibility and actually providing that validity to our work. And that's been picked up in the chat as well. And we can use these examples, these stories, and share them with public funders and also the audiences we're engaging with. It's also really important though that our staff and volunteers, whether that's in a physical activity setting, so our coaches, they also feel more connected to the experiences of people. There's something really powerful about engaging with individuals, and it's important we take time to understand our individual stories. And probably it goes without saying, but as an organisation, you're also more likely to have participants that have lived experience of mental health problems attending your services. And ultimately, that's an outcome we're all working towards. So Elsa, do you want to talk us through some of those individual benefits as well?
Yeah, so loads of benefits for people, for individual people. So we've got people feeling more connected. I mean, for me especially, I know that I've really found my community and made so many amazing friends through lived experience opportunities. So yeah, definitely feeling a connection to people has been one of the most valuable things for me in all of my roles. So yeah, really, really important one. They feel valued and respected. Yeah, I mean, pretty something we want to empower people to feel valued all the time. And as I mentioned earlier, when you're sharing such personal experiences, yeah, really important to make sure those people feel like they are being heard and respected in that space. Meeting other people with similar experiences, a little bit, it kind of links to feeling connected with a community as well. And yeah, meeting like-minded people and people you can kind of share something with. Developing skills and confidence. I mean, again, something personally that I have developed I started volunteering with charities when I was about 14 and I'm 22 now, and obviously part of that is growing up, but I've built so much confidence, so much more confidence through my the opportunities I've had to share my experiences, including opportunities like this, which is always helping me build new skills and be more confident with speaking. So yeah, possible future employment opportunities. Of course, networking is always good, and just building skills again links onto that. And finally, being more motivated to take part in activities that meet their needs. I actually think this is really important because a lot of the time, especially for people who might have additional needs, it can be difficult to find opportunities that they can access in a kind of simple way where they aren't having to kind of meet the needs of the people they're working with, and rather they are met where they are. And I think if you can really provide a space where they feel that empowerment and they feel like they have found a really safe space for them to engage safely, that will really help motivate and empower them in the future moving forward with accessing future opportunities. So yeah, really important. Sorry, muting myself prematurely there. So we've got a quote here from a member of Mind's Physical Activity Lived Experience group, which really captures how being involved in opportunities can have a range of positive physical and mental benefits. So as you can see on the screen, they said, being a part of the group motivated me to be more active. I do more walking and running now. It has also given me more confidence to speak in a group setting and share my ideas and opinions. Really good quote.
Brilliant, thank you, Elsa. And yes, some wonderful reflections. And as Carlo's just posted in the chat kindly, you can access all this information on that lived experience involvement from our toolkit. So do click on that link following the webinar, and we'll make sure we share the slides after. At this point, we just wanted to share a bit of a case study about what we've been doing at Mind. And Carla, who's kindly monitoring the chat and also speaking later in the conference, has been leading on a fantastic programme with England Boxing to co-design a new social prescribing programme for young people aged 10 to 16 with mild to moderate mental health problems. So Box to Beat It is a mixture of mentoring, but also then non-contact boxing aimed at supporting young people's mental health. And many of the young people who attend that program will have been referred in by link workers who may, and those young people may be on waiting lists for CAMS. The pilot itself is being delivered by 6 boxing clubs across England, and they've all received mental health first aid training and the 2-day Train the Trainer program. For this specific project that we've been piloting, we recruited young people from Mind Youth Voice Network, and they were involved in naming the program. They were also involved in then designing the activities, and that included acting as a bit of a critical friend around the language we use and making it age appropriate, but also relevant to the audience. The young people have then made decisions on when, where, and how the program should be delivered. So, for example, they made some great suggestions around the importance of creating accessible spaces and potentially even introducing wellbeing zones or areas where young people participating in this can take a break if needed for their mental health. They've also advised on potential barriers that could prevent engagement, and we'll explore some of these barriers that have came up in that discussion and from our other research later in this webinar. Co-design was really important to developing this programme, and I think it's really important that we're trying to work towards a safe and effective programme that meets the needs of young people or any participants. We really draw on some of the benefits of lived experience and think about how we can do that engagement at the higher levels of the lived experience ladder. So you may have listened and felt inspired, hopefully, by the importance of engaging people in the design of your programs. But we know it's not easy, and actually that first step can be really difficult. So if you're looking to potentially, off the back of this, build some relationships, we'd really encourage you to get in touch with local mental health organisations, and they might be able to help you with the recruitment of people with lived experience of mental health problems. They can help put you in contact and also make sure that you've then got the right support in place to support your team that are delivering, but also to support the individuals that are participating in your programs. Do know, obviously, that when you're approaching local mental health organisations, consider what they offer and also the services that they offer. And if you're interested, it's worth saying that Mind has a network of 100 local minds, or just over, that can support you. But there's also a fantastic range of local organisations across England and Wales, and obviously in the east of England. And you can use the Hub of Hope, which is a new database for finding different local organisations simply by entering your postcode. So definitely worth checking them out. Also, if you need support in engaging people with severe mental health problems, Rethink have support groups across the country, and also we'll be hearing from them a bit later in the conference, so do check out their work. It is worth noting though, mental health services, as many of us will know, do often run capacity, and they might not always be able to help, but hopefully they can point you in the right direction. And if you do need any further information on where to find those mental health organisations, do follow the link in the chat to the Guide 3 Bath Physical Activity Toolkit. So now that we've touched on how to engage people in terms of with lived experience, we wanted to turn back to the chat now and discuss some of the benefits to engaging people within your programs. And I'd love to know how you've engaged people in the design of physical activity programs. Potentially this might not be actually with people with lived experience of mental health, but it'd be great to share with those on the call. What have you done to engage people in the design of your physical activity programs? Have you done this in any kind of particular way? And if you could share one example in the chat, that would be fantastic. Again, I'm going to pause for a minute as we give you the opportunity to contribute and share some of that great practice that's already happening across the east of England. Tom, thanks for kicking things off. This is a bit of a harder question to answer, but yeah, feeding back from previous projects is a great way. Julie, great to hear. Yeah, focus groups and surveys. There's lots of different ways. And if you're struggling with a specific example, it'd be great to also know what you do to make them feel included as well. Jackie, that's amazing to hear about your tennis program, and I'm sure people want to link in on the back of that if they're not already. Liz, yeah, recognizing the importance of understanding what they enjoy. And yeah, Emily, drawing those conversations with community groups that you're targeting. Siobhan, it's great to hear about your work with schools and church groups. And I think the responses fly in. There's examples that are already happening across the sector where we're doing this. So we need to continue championing this and also sharing with one another. Please do continue offering those suggestions in the chat. But I'm going to pass to Elsa now just to explain through a model that we use at Mind and is part of our toolkit about engaging people in the design of physical activity programs. So Elsa, over to you.
Awesome. Yeah, I got carried away reading those responses because they're so interesting. Yeah, really, really cool ideas. Yeah, I'm gonna close the chat actually because I will just keep reading them. Yeah, so if you are kind of struggling with this, we've got a really useful sort of starting point for thinking about engaging people in the design of physical activity programs. So once you have kind of co-designed the program, the next step is about how you engage people in those activities. And finding ways to help people understand that there are so many ways to be active, which is sometimes easy to forget, and we can get very bogged down in like the stats around physical activity and the kind of progress that we need to be making, but actually, yeah, helping people understand all of the ways that we can be active and benefit from moving our bodies is really important. So from running a marathon to chair-based stretches, for example, we can help them consider the obstacles that might be in their way or the barriers they might find, but allow them to find the movement that's right for them. So offering the opportunity to watch your activity, for example, meet some of the participants, or even have a chat prior to the session can help people feel at ease and reduce feelings of anxiety or nervousness. I know for me, like I get really anxious meeting new people and it's a very overwhelming experience for me. So I love that idea of allowing people to just watch a session or come and check in with a coach before deciding to sign up for a session, for example. But the East model that we've got on that's coming up on the screen even, is a great place to start. So we have our E, which stands for easy for me to attend. So thinking about the accessibility of that session or what you're delivering. So do they have the information about the session and know what they need to bring with them? Is it easy for them to find and travel to the session, for example? Again, just to use a personal example, I find it really helpful when I'm sent the information about locations and different ways you can get there and the number of people in a session before I attend. So I think that can be really valuable for people. Sometimes I'm worrying, for example, I'm going back to tennis tonight after 4 years. And I'll ask them how many people are going to be in the class and things like that. And I think just being open to providing that information is really good, because I would be way more nervous than I am knowing that we're a nice small group this evening for my return to the tennis club. The A is attractive. Is it attractive to people? Attractive to people like me? I know it's for me, and there will be like-minded people. So kind of going back to the point around connection and community that we were talking about earlier, thinking about the kind of people you're trying to engage, and whether you're promoting it in a really inclusive way. So for example, are the people featured on the posters from the same community as me, might be a question that people ask before they go to a session. Or does kind of marketing contain quotes and testimonials from people that they can relate to. Really important and not to be underestimated. Our S is for the social context within, sorry, let me do that again. The S is for social, basically. Is it social and comfortable, and is it somewhere where people feel comfortable attending? For example, is it in a local park or community centre? Is it designed for people at a similar life stage or with similar interests? For example, parents with kids, or older people, or members of my faith community. So thinking about the different types of communities and who people will feel more comfortable engaging in what you're offering. Yeah, so just having a think about that. And then the T finally is for timely. So is the session being run at a time of day that suits me and fits with my life stage, or my lifestyle? So for example, for people experiencing mental health problems, you can think about factors such as the effects of medication and how mental health fluctuates. Really important. Participants might not be able to attend every session, and may prefer sessions that start later in the day. So thinking about how you take a flexible approach and a really open-minded approach, so that you can so that they can attend as much or as little as they feel able to, but in a really safe and comfortable way. And remember, people are likely to identify with more than one community because of factors such as their faith, ethnicity, sexuality, gender, or age. So thinking about that kind of intersectionality and how people will belong to many different communities. And yeah, really, really important. And yeah, just a nice way for you to, maybe a nice starting point for you to use if you're maybe struggling to think about how to engage people.
Brilliant. Thank you for running through that, Elsa, and giving those examples. And as Tom said in the chat, the EAST model really should be easy for you all to remember in your region. I promise we don't change it up for different regions, and this is all in our toolkit. So yeah, just focusing on that. Easy, attractive, social, and timely is really, really important when you're moving to explore and co-design how to engage people in your programs. Brilliant. Well, we're sort of touching on a few of these already through the EAST model, and there's been some good examples in the chat. But again, we wanted to use this space in the conference to share a little bit about some of the barriers that people with mental health problems face in sport and physical activity. And again, I'm going to pause for a minute and ask that you consider the various different barriers that the communities you're engaging might experience. I think we've already had a fantastic example from Heidi, again, who's worked with local mosques and to develop the activities because of the barrier to participation for female members. So I'm going to pause for a second, and I'd really encourage you to post in the chat 1 or 2 examples from your work that you've seen in terms of barriers to participation for people with mental health problems. We'll share a couple of those bits of good practice, and then we'll explore some of those barriers in a little bit more detail. So I'm going to pause and encourage a few reflections from across the east of England. Thank you, Kelly. Yeah, that environment safety, so creating a safe environment is absolutely key, and we'll explore that in a little bit. Loads of responses coming from here, and that fear of not being good enough, I think that's really important, Jackie. Confidence comes through, a few of you have mentioned that. And yeah, Sarah points out, and Elsa referenced earlier, not being able to always attend sessions regularly can be a real barrier. Yeah, lots of different really, really valuable examples, especially even the side effects of medication, which we'll explore a little bit in a second. Emma, what a valid point there about a one size fits all approach. isn't necessarily the one we should be taking. And Helen making a really valid point about cost. That continues, especially kind of on the back of a cost of living crisis, which is still going on. That will be a massive problem for certain individuals. Kelly, a really valid suggestion as well about previous experiences. So actually, a negative experience in the past can really impact someone's ability to then gain the confidence to go back again because of the impact that they would have had on their mental health. And Siobhan noting as well, those undisclosed physical conditions, which also might relate to the mental health problems we're experiencing. Well, thank you so much for your contributions in the chat. There's so many great examples. What we're going to do now is just draw on a few that have already probably been explored in the chat, but do keep them coming as we talk through these. So at Mind, we use a four-corner model to describe those barriers to physical activity for people with mental health problems. And these barriers are similar for people with and without mental health problems. So for example, traveling to a venue or a lack of confidence or attending a new session, as people have said in the chat, they're something we'll all experience, but they can be exacerbated if we've experienced a mental health problem. So for example, most people will feel apprehensive around starting a new activity, but actually for people with mental health problems, that anxiety might develop and impact their daily life and how their ability to manage their mental health. So we've grouped those into 4 different categories. And again, there've been some brilliant examples in the chat. But in terms of those physical aspects, those physical barriers can include the accessibility of venues. So as Elsa said a bit earlier around the travel to venues, potentially could you within your own organisation provide some travel to support to people with accessibility needs? Or even could you work with partners to provide sessions in a range of community venues, taking your sessions to those spaces where you can reach new audiences? There's all sorts of other physical barriers, as you can see on the screen. And I think they were picked up in the chat about the effects of medication. So this can impact all sorts of things, whether that's weight gain, we might struggle in terms of regulating our temperature, and it can lead to sweating, which might make people feel more uncomfortable engaging in high intensity physical activity. Medication can also affect our ability to sleep. It can lead to us experiencing anxious thoughts, and we might just feel more tired. So when, as Elsa said, you're encouraging people to sign up to your sessions, think about the times of day that you're able to offer those sessions, and also maybe encourage people to sign up when they're feeling more awake. As has been picked up in the chat as well, there's all kinds of other health conditions or disabilities that we need to consider. So really ensuring that participants complete a PARQ, so the coach is aware of their different needs and can differentiate the session accordingly is really important to overcoming some of those barriers. Moving on to the psychological barriers, and again, there's a lot of overlap between. But the anxiety that we might feel about going into a new setting has been picked up a lot by your contributions. And as Elsa suggested, potentially you could provide an image or a video of the venue to make people feel more comfortable about the setting. And make sure that any imagery you are using in your promotional materials accurately reflects the session. So actually, the size of the group or the setting that you're exercising in is really important to accurately portray. To ease some of those psychological barriers as well, can you and your individuals working within your teams check in with participants before the session? A check-in might be an opportunity to explain what you'll be doing. It might even be an opportunity to answer any questions. And again, that will really help to ease some of those anxieties that we might experience. Naturally, people that experience a mental health problem might also have difficulties with decision-making. But there's ways of addressing this and using physical activity and movement to combat some of those fears around decision-making skills. So maybe think about within your sessions about providing different opportunities for participants to improve their decision-making skills. So for example, instead of participating as a player, potentially someone new to a session might be keen to just support as an official during the match, or to help out in a different way. There's also other psychological barriers that are on the screen, the fear of judgment and not being good enough to take part. And we really need to think about all of these barriers when we're encouraging people to engage in our sessions. The third area kind of we've grouped them into is technical barriers. And again, with experts on this call, you've already suggested some of these. But it can be really challenging if we're experiencing a mental health problem or feeling that there's a huge amount of pressure on us, that we also might be nervous about our lack of understanding of rules or how to play it, especially if we haven't experienced that kind of movement before. So keep things simple in your sessions, it goes without saying, but also potentially explore how you could offer a taster session. Again, maybe where someone brings along a buddy. We've also would really encourage you to make sure that you've got the right training in place for your staff. So there's a real shortage of mental health or disability aware or kind of coaches that are upskilled in these areas. So make sure you provide that appropriate training. And at the end of this webinar, we'll share a bit about the training that Mind offers in terms of our mental health in sport and physical activity e-learning course. The first step whenever we're addressing some of these technical barriers should be asking the participant though about their needs. And that's really important to remember. Oh, sorry, I've clicked through one too many. And finally then the social barriers. So these have kind of been touched on a bit already, but they might include the challenges of having no one to go with to a session. So make sure you're speaking to your participants about what you could do to ease their anxieties. Attending a session can be really intimidating. So can you offer a point of contact where participants can speak to you ahead of the session, and actually maintaining that same point of contact for the first few weeks or few months is really important in terms of easing that anxiety. Don't forget though that we need to also champion and celebrate the impact that physical activity will have in supporting and overcoming some of these barriers. So if participants that maybe have already been involved in the programme are happy for you to do so, why don't you showcase some of those benefits and ask them to share their stories or to buddy up with a new participant? It goes without saying as well that in terms of those social barriers, we need to consider the cost of sessions and address the stigma that we all still experience around mental health. Guide 5 of our physical activity mental health toolkit provides loads more information on these barriers and also examples of how to overcome them, and consequently, how to engage people in physical activity to support their mental health. So we'd encourage you to take a look at that. Carla's kindly posted that in the chat. And I think it's a really good place to start in terms of thinking about what you can do to kind of further your engagement with people with lived experience of mental health problems. Very quickly, we just wanted to then touch on the key ingredients to supporting people with mental health problems. And this slide was developed in collaboration with Loughborough University, who evaluated our Get Set to Go programme. They identified key active ingredients or recommendations which help physical activity providers to support people with mental health problems to be active. We've discussed a lot of the ingredients this morning, and I think some of them will really resonate with individuals. So please do check those out in our Guide 4 of our toolkit, which you can find online, and Carla has kindly posted in the chat. Just before we wrap up and answer any questions that might have come up in the Q&A, we just wanted to share a couple of examples of the work that Elsa and the young people did in terms of our steering group. And those young people incredibly created an amazing lived experience video where they shared their stories. They've developed some amazing top tips and also a handbook for coaches, which you can access through our young people's pages. A lot of this is very similar to the CARE model, which many of you might be aware of, and again, you can find in our toolkits. But Elsa, do you want to touch on a few of the examples from the young people's work, which obviously resonate with all audiences, about how to support particular audiences during your physical activity sessions?
Yeah, absolutely. I'll try to whiz through a little bit so that you guys can ask any questions if you've got them. But yeah, as James said, these are applicable for all ages, even though they follow the acronym young people. But our first one is young person focused, but I guess like person-centered based on like the communities that you're working with or the people that you're engaging with. So find out what each person wants to get out of that session, and allow them time to set those like achievable goals, and reflect on their progress and personal achievements. Really important. We've got observe. I think really important, like observe and listen, and kind of provide space for you to recognize if behavior changes throughout a session, so that you can acknowledge that and support people in whatever way they kind of need. So I think, yeah, being really observant is super important. And also just on that, maybe an idea to like, so if people have additional needs or they need some extra support, thinking about how you can set up a wellbeing plan prior to the session, so that you can recognize those changes or things that they've said. You know, if they might think, oh, if I go a bit quiet, just check in on me, for example. A really nice way for you to kind of keep in tune with people's changing behaviors in a session. Understand aim to understand mental health problems that affect people today. We've talked about things like the cost of living and various other challenges that we're just facing generally every day. And of course, we all have mental health, and it's important to acknowledge that there are things that are going to be affecting us all every day. So yeah, really understanding and increasing your knowledge and awareness of mental health problems. Asking non-judgmental questions and creating a non-judgmental space. Some people have mentioned in the chat about people feeling a bit anxious about being judged, or not feeling so confident in their ability to like participate with other people. So just creating a really non-judgmental space is super important. And being encouraging, give encouragement wherever possible, of course. We've got personalize. Everyone is different and has different experiences of mental health, so really personalizing sessions to meet their needs, really important. Being engaging, checking in, just being that safe person that people can go to, and being kind of an engaging person. Openness, normalize talking about mental health. As I just mentioned, like we do all have mental health, and we don't all have mental illness, mental ill health, but we all experience mental health as we do physical health. And just, you know, normalizing those conversations is so powerful. So can you kind of include that in a warm-up or a cool down exercise, just being really mindful and bringing it back to how we're feeling. Praise, again, a bit like celebrating and encouraging, being, you know, focusing on positive progress, not being really bogged down in like the stats and the kind of competitive side of sports that can sometimes become very overwhelming. So, you know, being encouraging and praise, super important. Then we've got learn, giving feedback. We're all learning. We're all like, I know I'm going to go back to tennis after 4 years tonight and be like, I don't know how to hold a racket. You know, it's a space for learning, and we want to allow that really safe space for just learning a new skill. And finally, we have enjoyment. Again, like, you know, all of that kind of encapsulates, if you can get all of that in, they're really going to enjoy a session, and enjoyment is the most important part. So making sessions fun and adapting activities so that people can just relax and feel like they are getting as much out of their moving their bodies as they possibly can. So yeah, they are some of our tips.
Brilliant. Thank you, Elsa, for running through those. And yeah, like we say, if you want to access any of those, Carla's kindly posted the link in the chat to our young people's resources. Just before we conclude then, we just wanted to outline Mind Support. So we've got a physical activity team that have designed a lot of our toolkits with people with lived experience, and also the sports sector. All our resources, training, toolkits, guidance, they can be accessed via our web pages, which are www.mind.org.uk/sport. Or if you feel able to, you can always scan the QR code, and we'll post the relevant links in the chat. If you've come away from this conference inspired, but also want to then increase your knowledge around physical activity, If you haven't already, do check out our mental health awareness for sport and physical activity e-learning. It's a 2 to 3 hour course online, and really explore some of these themes in terms of barriers and the importance of engaging different communities within your work. We also have a physical activity and mental health newsletter, which I know many of these people on the call are signed up to already. This shares a lot of good practice, and I think it's really important to continue doing that. The examples you've provided in the chat today have been so valuable. So please do sign up to that, and if you want to promote any of your work, please do. And very finally, we just wanted to give a quick plug for our self-care library. Today's session has been quite focused on engaging others in our sessions. But whenever we're experiencing our that challenge of overcoming barriers and engaging people with lived experience of mental health problems, it's really important that we think about our own mental well-being. So please do have a look at our self-care library. It's a fantastic resource which includes grounding techniques, breathing techniques, and all different ways of supporting our own individual mental health. I think at this stage, we just wanted to say a massive thank you. It's been a real pleasure hearing from you in the chat, and we've really enjoyed engaging and sharing some of our toolkits. If you do want to continue the conversation, you can contact our sport and physical activity team. But I think at this stage, we'll probably pause, and I don't know if we've got time for a couple of questions, but Tom, back over to you to see what you think on that stage.
Thanks, James and Elsa. I thought that was really insightful. Some great insights there that people can take away and apply. There's one question in the chat currently. I'll give time in case people want to add any more, but I'll throw this to you now. So Paula asks, what timescales would you say is sufficient to affect positive changes and create sustainability once the program finishes?
That's a really good question, and I don't want to not answer it directly, but it will be very dependent on the situations that you are working within. I think, as we touched on in the session today, that feedback loop is really important. So actually, when we're working with funders, or potentially even within our own organisations, we need to be really clear about the fact that it does take time to engage people with lived experience at the start of our programmes. But I think as a sector, we have a challenge to also make sure that when we're accessing funding or planning programmes, we do build in that time for evaluation and to then complete that feedback loop. There's various different ways of doing it. And Paul, I think the best thing to do is to go back onto a couple of those toolkits and pick out a few examples. But it's a really, really good question. And I guess there's a simple answer of saying the more you can, the better. Yeah, I'd be really interested in hearing other people's contributions in the chat on that one, because it's a really good point.
That's the only question we actually had, James. So you obviously done a really good job of explaining everything.
Well, we'll take that as a positive. So yeah, thank you very much for having us. I'll stay on for the rest of the conference. And yeah, Elsa, a massive thank you to you as well. We've really enjoyed presenting. And yeah, do let us know if we can support